Greetings to everyone. I'm Mary Jan, occupational therapist from Lost District Hospital. Today, I will present on the topic Home Training Package with Telecare Support, improve the accessibility of occupational therapy for people with dementia amid the COVID-19 pandemic. The COVID-19 pandemic has significant negative impacts on us, especially for people with dementia. Caring for them becomes profoundly challenging. They are particularly at risk of infection because they may not follow the suggested public health measures. Besides, the reduced outdoor activities and visits for family and friends also limited their social participation and community engagement. In addition, suspension of healthcare and social service resulted in treatment discontinuity in dementia care management. The above has resulted in possible worsening of cognitive, emotional, and behavioral conditions in people with dementia during the pandemic, which has been supported by evidence and studies worldwide. Nonetheless, caregivers may feel frustrated and helpless of being confined at home with restricted amount of activities with their care ones. To tackle the challenge, occupational therapists in North District Hospital have developed a structural home training package, HTP, with telecare for patients with mild to moderate dementia to improve accessibility of occupational therapy service with a new model of care. The use of HTP with telecare support aims to reduce adverse impacts, promote wellness and quality of life for people with dementia under COVID-19. This slide shows a life guideline that covers dementia diagnosis and management. This guideline recommended that structured psychoeducation and skill training intervention should be provided for all carers living with dementia. Our HTP emphasizes a personalized care plan with caregiver involvement. Through caregiver education and regular telecare support, we aim to empower caregivers in delivering prescribed activities at home competency. Also, this guideline recommended a range of activities to promote well-being that are tailored to the person's preferences to all people living with dementia. HTP focuses on planning enjoyable and meaningful activities to do with the person with dementia, which aims to enhance their treatment compliance towards the individualized home-based program. To improve the accessibility of dementia care service during COVID-19, a new model of care, which is supplementary to conventional face-to-face service delivery, is applied. The structured intervention program includes HTP and telecare support, in which evidence-based practice is emphasized and caregiver empowerment is fundamental to ensure sufficient monitoring and competency building of caregivers. Patients with mild to moderate dementia receiving occupational therapy service together with caregivers who are ready for home training program were recruited according to the selection criteria. Care experience survey design method focusing on service accessibility was applied. It measured the satisfaction with the quality and care of healthcare service provider to ensure better outcome. Outcome measures were utilization of HTP and telecare support, user satisfaction, related parameters for cognitive, activity of daily living, and social participation. From demographical data, 42 patients with dementia were recruited since August 2020 to January 2021, completed 8 weeks of structural intervention program. In terms of utilization, the majority of caregivers used the HTP 3.5 times per week. The use of telecare to support HTP was 4 times in average within 8-week program. In terms of user satisfaction, 90% of them would continue to use HTP with ongoing support from occupational therapy. All caregivers who are willing to continue HTP appreciated the telecare support, while less than 10% of them preferred face-to-face intervention. The survey also collected caregivers' feedback on various cognitive, social, and daily activities in HTP. The mostly engaged activities are weighted in the following order: include cognitive stimulation game, reality orientation, community engagement cards, and ADL strategy guides. Based on the captured result and user feedback, the following points of discussion has been summarized. Firstly, the intervention strategies in the HTP are evidence-based and recommended by the NICE guideline. Secondly, HTP with telecare support are cost-effective in training, and number of hospital visits may be reduced under COVID-19. Thirdly, the high compliance and utilization of structural intervention programs indicate competency of caregivers in conducting treatment at home. In addition, HTP and telecare are effective in caregivers' empowerment. Moreover, telecare support is effective for patient performance tracking and monitoring. Lastly, HTP is sustainable with low cost and enable patients to train at all times and all locations. The use of HTP, which combining the evidence-based intervention strategies with telecare support, could effectively empower the patient and caregiver to conduct the prescribed training competently at home. Patients and caregivers could benefit from this model of care in supporting the training at home to prevent possible worsening of cognitive, emotional, and behavioral conditions during the COVID-19 pandemic. Here's the reference list. That's the end of today's presentation. Thank you.